Right, Matt, are you ready for episode number 2?
I am ready, Pam. I am ready. Let's go. Say, I have a question for you.
What's
We've
that?
talked about this before, and I want your opinion on it. I've made the statement that dentistry has failed the public, especially for people with TMD. And now that you are in the dental schools and you're in the teaching environment, tell me what's going on.
Well, that is a saucy subject from my saucy colleague. Let me start because this might resonate with our listeners. Okay. And I know it's going to resonate with you, Mac. Um, when we've been treating TMD as long as we have, a lot of you listeners, you probably have seen, I don't know, anywhere from 4 to 6, 10 different doctors before you found me or Mac or people who treat patients like we do for TMJ issues. And it's failed, dentistry and medicine's failed the public because we wish you didn't have to go through all that suffering, all that expense. When people are having pain, vertigo, ear issues, eye issues, they get to us to a point where they are frantic, they're depressed, and typically medicated. A lot of times, I mean, Mac, they think that they're crazy. I hate that word. And they think that they have some kind of undiagnosed tumor. A lot of times their relationships are falling apart. The whole world's, their careers is falling apart because they live with debilitating pain. And quite often you see it in their eyes. You see
Oh,
that they're on the point of suicide. That's heartbreaking. 20 plus years doing this, I can't help but feel for each one of these people.
well, it
And
is hard. It is heartbreaking, Pam, and especially, and you've already mentioned like tumors. So people don't know about this pain. You know, if you break your leg, you set it in a cast, it heals. Everybody knows you're going to be okay. But you have this pain, and it's always going on. Your spouse doesn't understand it. Your loved ones don't understand it. You're misunderstood by everybody,
so
and you're
true.
sent to a neurologist, and the neurologist says, "I don't know of anything wrong. Let's do an MRI." That scares the living life out of you, and then you're waiting for the report, and you know it's going to be bad, and then you go, and the neurologist says, "I got your report back. You're perfectly fine. There's nothing wrong with you." And
Right.
then they get kicked down the road once
Right.
again.